Hello everyone, this is our first live season. First of all, welcome to Healing Journey. I'm Dr. Mehmet. I have been working as a radiologist in my own radiology center, and also I'm the founder of Healing Journey Medical Travel. Healing Journey is a medical travel company in Antalya. We cover all kinds of treatments, from weight loss surgeries to plastic surgeries, from organ transplant to cancer treatments. We think that the surgery is only a starting point. Healing process is beyond the surgery. Pre-op evaluation, post-op care, and follow-up are the most important parts where Healing Journey steps in. Today, we are going to talk about weight loss treatments with nutrition specialist Mestan Hüseyin Cilekci. Welcome, Mestan. How are you?
I'm good. How are you, Dr. Charlo?
I am doing well. Thank you very much. Can you introduce yourself to our followers?
Of course. This is Mestan Cilekci. I'm a dietitian. I work Galatasaray Sport Club. Also, I work on the bariatric surgery and the medical nutrition therapy. And also, glad to be here. Thank you for your invitation.
You forgot to talk about Galatasaray, the best team of Turkey, Galatasaray. You are.
Thank you.
First of all, I want to mention that weight loss treatments are not cosmetic surgeries. These treatments are performed to improve your health conditions and to reduce the risk of chronic disease such as type 2 diabetes, hypertension, sleep apnea. And there are some criteria. Mr. Mestan will explain that criteria too. We will discuss together. I want to inform and mention again, weight loss treatments alone are not enough to lose weight. It only helps you. You must change your lifestyle totally. You must follow all post-op instruction. You must stick diet plan. If you are not ready to change your lifestyle, there is no need to rush. You should be ready mentally. It is not an easy process. It is a long-term life changer treatment. And the most important part of this treatment is diet. Some patients think after surgery, they lose weight easily. But if they follow the diet plan, post-op instruction, it is impossible. And it is not an easy process. They really stick to the diet plan. I think it is not an easy process.
After the surgery, nutrition plan, it's more important than the surgery. But it's really not easy because there are some parts about the nutrition plan. The first day, after 2 weeks, and after 4 weeks, and 6 months, and 1 year. And it's really important. Some
patients really don't know about the process. And after the surgery, they shock.
Yeah.
First 1 month. What is first 1 month?
I saw.
Eat, okay, don't eat. They must be ready mentally for this.
Decide to surgery, they have to know.
I think the surgery is not be the first choice. First, they must try non-surgical methods. And they must do diet plans. We saw that some patients ask us for this surgery. We asked them, did you try non-surgical methods? If no, please first try the natural non-surgical methods. And after you fail, okay, now you can try this weight loss treatments because this surgeries is performed to improve your health and to reduce the risk of other chronic disease. Because a higher BMI, they have higher risk than the surgery. At over 40, 45 BMI, they have a lot of risk of other chronic disease, heart strokes, cancer risk, and a lot of related disease. Do you want to add additional information?
I agree with you. The first step, the other methods, such as medical nutrition therapy. And as you say, there are some criteria, not just about body mass index. You ask always, did you use any nutrition therapy? But if they don't, after we can talk about the bariatric surgery.
Yes, thank you. I think many people don't know about body mass index too, because sometimes we get some inquiries about 25, 24, 26 body mass index. Body mass index, our followers can check it in Google. They can calculate their body mass index. If their body mass index between 30 and 35, and if they have an additional chronic disease such as type 2 diabetes, hypertension, and if their body mass index over 35, yes, they are candidate for this surgery, but only a candidate because there are many criteria for this surgery. Before surgery, evaluation, pre-evaluation must be done. When they come here, we make pre-op tests. We test their lung function, liver function, heart function, and many tests performed. And if they are suitable for this surgery, they get this surgery. And for BMI 27, over 27, there is another option, gastric balloon procedure. It has less complication risk. But again, with gastric balloon, if they don't stick to the diet plan, they lose weight, but they regain weight again. In all weight loss treatments, diet must be part of this treatment.
Yes.
We got some questions from our followers yesterday. Mr. Ali, can you send our first question, please? Being young in age, how does it affect? People generally ask this. There is no negative effect on your fertility. We can say that losing weight will positively affect your fertility. Gastric sleeve improve factors related with infertility. However, necessary to wait at least 1 year to have a baby after gastric sleeve surgery. This is important for both mother and child health. And another question, if they want to have a child first and then undergo surgery, we advise them you should wait for the end of breastfeeding period for this surgery. And Mestan, this question for you. Mr. Alican, our second question.
Our second question is, can I fast during Ramadan after gastric sleeve?
Yes, and since Ramadan is approaching, you must be wondering whether you can fast, but we don't recommend this, at least for the first and 2 years, because long-term fasting and a prolonged lack of fluids will harm you. Your metabolism slow down. It should not be forgotten that protein intake separated over the 3 and 4 times a day is more effective than protein intake all at once, and it protects your muscle much better.
So they should wait at least 1 or 2 years for
yes.
fasting. Okay, thank you, Estan. Now our third question, Mr. Ali, can you send? How long will my full recovery take after the operation? Gastric sleeve surgery is laparoscopic surgery. It is performed through small keyholes without a large incision in your body. Your recovery period will not take too long. Nearly 3 or 4 weeks later, you will be able to do any physical activity that you desire, including sports and other similar activities. For gastric sleeve operation, you should stay hospital at least 3 nights. For gastric balloon treatment, it's a 1-day operation. You don't need to stay in hospital. And again, after gastric balloon, there is not a 3 or 4 weeks period. You can start your gastric balloon operation. Can you tell us our 4 question? This question for you, Mr. Mes. If you wish, Mestan, you can explain after surgery, which vitamins, which proteins?
Shrink by about 80%. This means you will only be able to eat small portions compared to the normal person. However, your body will still require the same amount of nutrients as before to avoid negative consequences such as a muscle loss, hair loss, white spots on the nails, weakened immune system, and the fatigue. It is recommended that you take the supplements. That's why after gastric surgery, it is recommended to use supplements such as a protein, especially in 3 months, multivitamins, and probiotics for at least 3 months.
Thank you. What is our next question, Mr. Ali? Yes, we include medicine, not only medicine. As I told before, as I mentioned before, the surgery is only a starting point. The healing process starts before the surgery. We get all medical history. We make pre-evaluation for the surgery. When they come here, we make pre-op test. And after the surgery finish, if any complication arises, as in all surgery, there is complication risk. We manage the complication and everything is okay. After they go back home, we make follow-up aftercare, the most important part. And also, we give all medications, all medical protein, vitamin supplements which they need. And we give online dietitian support, which is crucial for the first month because they need guide how they eat, how they drink. For example, Mestan, what about your patients? They really stick on the diet, or what is the success rate? They can do it easily.
It is really a hard process, but
how you manage
80%. 80%.
Yeah. 20% is don't follow.
Yes.
Because they are not needed.
Yeah, as you say, they was shocked after the surgery. If you talk about the 20%, they was shocked. So they didn't use. Because
in daily life, I saw that some patients think they get the surgery and they keep going to eat as before, as previous. It is unlogical and it is impossible. There is no pain, no gain in everything. You must follow all diet plans. If you are not ready for this surgery, There is no need to rush. Next question, we can answer that. What is the next question, Mr. Ali? Do I need to quit smoking? Very good question. Not before surgery. Smoking is harmful. Everyone must left smoking. But as you know, it is very hard to change habits like eating habits, smoking. If you can't change, if you decide to get this surgery, you must left 2 weeks before and 2 weeks later. You mustn't smoke because smoking has a really negative impact on anesthesia and the healing process as it reduces oxygen levels in the blood. It is important to remember that this surgery helps with weight loss by providing an opportunity to change habits. Maybe you are obese and at the same time you are smoking. Maybe with this surgery, you can left smoking too. My answer to this question, if you can, totally left smoking. If you can, at least 2 weeks before and 2 weeks later, you must left smoking to fast recovery time. Here's the next question, please, Mr. Ali. This question for Mr. Mestan.
I can say a few sentences about the post-operative constipation. This is a situation we encounter after the surgery because the amount and the types of nutrients taken are changing and decreasing. To prevent and fix this situation, please ensure you are adequately hydrated. Consume your vegetable purees and don't forget to consume yogurt and kefir, and it should be lactose free. And also the supplementation, you have to use supplementation for good health. Probiotic supplementation for your good health.
Mestan, will we see constipation always after the surgery? It is, or how long we see it?
It depends on the patient. If you use the nutrition guidelines, it will take a few weeks.
Thank you very much.
Yeah.
Next question, Mr. Ali. Please. Yes, you can bring a companion, and many patients find it helpful to have a friend or family member with them for support. Again, many questions, Mr. Mestan, they ask, is it painful? Yes, the surgery is painful. Or is it hard? Can I walk? Can I go toilet in hospital? Yes, there are nurses and health professionals, but they will feel more comfortable with their friends and with their family members. And also we have an extra sofa for the accompanied person and meals also provided for the accompanied person. So we recommend to get someone with you for this surgery. Next question, please, Mr. Ali. Yes, as we talked before, this surgery is performed to improve your health conditions, to reduce the risk. Yes, if you have an underactive thyroid, bariatric surgery helps to improve your thyroid function. After the surgery, there is a decrease in autoimmune symptoms and side effects of Hashimoto disease, and improvement in thyroid function compared to the past, and a decrease in the need for medication. So there is no problem if you have a thyroid disease. There is no restriction. It is also good for you. This surgery is improve your health. Yes, next question, please. What does your insurance cover for complications during a 4-day hospital stay? Our question, Mestan. I don't know if you see the question or not. As you know, all surgeries has own risk. There are many complication risks. We try to reduce to all complication risk. As Healing Journey, what are we doing? We choose the experienced doctor whose complication rate is low. We choose the hospitals which their intensive care unit facilities is good. If there is a complication arise, there must be a team to manage the complication. We choose that team in hospitals. As I told before, the surgery is only a starting point. It beyond the surgery, before, during, and after. And if the complication arises, we recommend our patients medical travel insurance. This insurance cover the complications which arise in Turkey when they are still in Turkey. The early complications such as bleeding, leak, infection. Maybe they should stay 1 or 2 more nights in hospital. If we see late complication, it covers small interventions in their country. Maybe if long-term complications, if they have to come back to Turkey, we cover their second treatment, their flight ticket, their accommodation. So yes, we suggest, we advise, we recommend our patients to get this complication insurance. What is the next question, Mr. Ali?
What percentage has the surgery been successful?
As Mr. Mestan told us, it is the same. It depends on patients many times. Diet plans, Mr. Mestan said 80-90% is successful. The success rate of gastric sleeve surgery typically around 85-90. It is similar to diet plan because, as we told, the surgery is that now it is surgery, psychiatric support, and the dietitian support. It must be all together, and it is a long-term treatment. It is not a short-term treatment. We always tell to our patients, we don't expect to lose weight in 1 month, 2 months. It is not healthy. We expect you lose your 80 or 90% of excess weight in 1 year. It's a long-term treatment. And with gastric balloon, Allurion Balloon, for example, we expect after 4 months later, 10% or 15% of your total weight. Sometimes expectations is very high, Mesna. They think after these treatments, everything will be fine. But it is impossible. They only work.
It's not easy.
Yeah, it is not an easy process. They must think twice. They must be ready for mentally. And again, for example, people come to Turkey for treatment abroad because in UK, in USA, in other countries, there are too long waiting times and there are very expensive treatments because of people choose such countries like Turkey. Turkey is one of the best countries in medical tourism. I can advise to our followers too, how can they choose a safety clinic and hospital? The Ministry of Health give a certificate to companies like us. It is medical travel license. They must ask that license and they must ask who is the doctor, where is the hospital. They must know everything about the treatment and they must ask how is the follow-up, or only they make surgery and send the patient. Very important, the follow-up part. The hospitals and clinics primarily focus on treatment. They don't have a team for follow-up all patients because they have many patients. The success rate is again depend on follow-up. We follow up all our patients. How is their weight loss journey going? And again, if you don't follow the post-op instruction and diet, you will regain weight and might see possible complications. So, Mr. Ali, next question, and we have last 2 questions. After that, Mestan, we make a summarize and we say goodbye to our followers.
We have some new question in the chat. If you want, we can jump on the new ones from the chat, or we can continue the old ones.
The new one we can get.
Okay, it's from the chat.
Yeah.
What are the options to get hanging loose skin removed?
I think it is very early to think about excess skin because, as I told, these treatments 1 or 2 years it takes. It's a long-term treatment. After 1.5 years later, yes, we see some sagging skins, maybe arms, maybe tight, maybe their tummy. According to their needs and wishes, there is some such plastic surgeries. We call them post-bariatric body contouring. After 1.5 years later, after their weight loss treatment finish, after their weight loss journey finished, okay, yes, we can cover it too. We have that kind of treatments. They can get these surgeries because it is again about health, not cosmetic, because they have a lot of weight. When they lose, their skin is sagging. It is not for cosmetic, for healthy. For health, it must be repaired. So
we have another live chat question. What is a high risk after getting the surgery?
There are a lot of risk in all surgeries. The highest risk is that there are some kind of risk, but it is very low because of anesthesia, because of other complications. There are many kind of risks, but in gastric sleeve, it is very less. Because of it, the surgery association suggests this surgery. Alican, I can tell like that, to have a higher BMI like 45-50 have more risk than any surgery. Again, with over BMI, you have heart stroke, heart disease, and that risk too. Because of this surgery should be performed to reduce your risk. Yes.
Okay, doctor. Our last 2 questions are related with the gastric balloon. First is very essential question. It is very basic. What is a gastric balloon?
And second one?
Second one is, what makes the Allurion balloon different from the other gastric balloons?
Okay, so I can answer both questions at the same time. Gastric balloon is another option for weight loss treatments. If your BMI between 27 and 35, maybe more higher. But if you don't want any surgery, you are not ready for surgery as mentally, but you want to make your BMI is lower, yes, there is an option. One option is Allurion Balloon. What is the Allurion Balloon? It is the first and only gastric balloon in the world that doesn't require any surgery, endoscopy, anesthesia, or placement or removal. And during a quick 15 minutes placement, the balloon is swallowed as a capsule, resulting in less downtime and fewer days of work for patients. The Allurion Balloon is designed to pass naturally at around 16 weeks. Do you know about Allurion Balloon, Mestan?
Yes, I know.
Nowadays, it's very popular because the other gastric balloon needs endoscopy and anesthesia, and it needs removal 6 months later or 12 months later. The patients have to come 2 times. But what is the advantage and disadvantage of these balloons? Allurion Balloon is stay only 4 months. It means it affects only 4 months. The other balloon stays 6 months and 12 months. It means it affects more to lose weight. But with Allurion Balloon, people can expect to lose 10 or 15% of their total weight. And another advantage, they can use 2 times Allurion Balloon in a year between 2 months interval. Nearly 25% of total weight they can lose. Maybe for people who don't want any surgery, maybe it helps them and they get motivation. If their BMI is lower, maybe they start to natural way with diet plan. What do you think about that?
I think so. It's more easier, more faster, and more healthier. I think it's good choice.
According to Gastric Sleeve.
Yes. But if BMI 27 and 30, 32 maybe.
I mean, their BMI is 36, for example. But he or she is not ready.
We have to check the other medical condition. I think.
Or they are not suitable for gastric sleeve surgery, or they don't want to get surgery. It is an option, but it doesn't have to make them to do healthy BMI. Maybe only 10%, 15%. But if they keep going to diet plan, they can do their self. I think there is no.
I agree with you.
There is no need to surgery. Maybe it's a good option too.
Yes.
Okay. So thank you very much, Mestan. But I want to tell last words, and I want to last words from you too.
We have a last question from the chat. If you want, I can tell you.
Last question. Okay, we get last question, and then we tell our last words about weight loss treatments.
The last question is, have you ever had a patient with BMI over 50 who have had any complications?
We have patients over 50 and they get that treatment and we didn't see complication. But as patients ask, yes, with over BMI, their risk is higher than the lower BMI for surgery and for the life too. If they do
patient in a more with obese, so
more with obese
complication.
Yes. They has already risk.
Yes.
So thank you very much, Mestan.
You're welcome. It's glad to be here and also talk with you about weight loss.
It was our first live season. I am very happy to invite you and you accept. I want to tell our followers, our patients again, weight loss treatments are not a cosmetic surgeries. There are some criteria. You must post-op instruction and follow-up diet plans. If you are not ready, there is no need to rush because it's a long-term treatment. If you don't follow, maybe in short term you lose weight, you regain weight again. One of the complications, regain weight again. You must be ready as mentally, and the surgery is not enough, and you need some support in this journey, especially if you go for a treatment in another company. Not only our company, there are many companies you can check in internet, license companies. They follow you up, and before you coming, they check your medical history. Yes, Mestan, what do you think? What is your last words about this?
Last sentence I can say, in addition and your sentence, the process is not really easy. Even at 10% weight loss in a 6 months is important, and if you don't pay attention, you will gain more weight, and you should pay close attention to your nutrition and take a nutrition supplement after the surgery. That's my last sentence.
Okay. And I want to add a few words too. We tell people do this, but what is the solution? They have higher BMI. They don't want to get surgery. So we can tell that patients, you must change your lifestyle. If you don't get surgery, if you have BMI over 35, 40, 45, and you are scared of surgery, or you have another additional disease, you can't get this surgery, you must change your lifestyle totally. If you are ready for change your lifestyle, this surgery can help you to reach your goals. What is our goal in this? What is our aim in this surgery? To get your BMI near the healthy weight. Thank you very much again. Mr. Ali, what do you want to tell? Please tell now.
Well, Aaron, I hope you can hear me now. I want to make an announcement. This live session will be in our post. We're going to post it in Reels. You can watch it later. If you missed a question, you can listen again. So there will be more of this. So see you next time.
Thank you very much, Mr. Ali. Thank you, Mestan. Thank you.
As I say, it's a glad to be here.
Thank you very much. As Mr. Ali told, we try to make this kind of videos and live sessions about any kind of treatments. You join us, our first live session. You make us happy. Thank you very much, Mestan.
Thank you. See you.
Bye-bye.